I would like to welcome you all here this morning for this very important launch of the HSE National Office of Suicide Prevention Rapid Area Assessment to Suicide and Community Response to Suicide and Suspected Suicide in Dublin South. This webinar is being recorded. Although the focus of this report is on Ballyfermot and Cherry Orchard, the findings are relevant to other areas, both in Dublin and in Ireland. Please, attendees, as you know, there's the chat box there. We'll welcome your questions. Hopefully we'll be able to answer some of them, but please put them in, and at some stage we'll definitely respond to your questions. My name is Suneva Finlay, and I'm the CEO of Ballyfermot Star. And I've been asked to chair the webinar by my colleagues in SPACE, Suicide Prevention and Community Response Group, the implementation team for the recommendations in this report, some of whom will be speaking here today. The focus of this report is on women, mainly young women, women who have children who have tragically died by suicide, sometimes in public places, devastating their families, friends, and those who live and work in the community. This feeling of devastation, fear, powerlessness that was felt by their loss was palpable at the time. People, residents were asking, what is happening to our young women? Is there going to be more deaths? And what's being done about it? It is in this climate that D10 Be Well, a group of local organisations who had formed to support the development of mental health in the community, that the issue of suicide and what was happening in the community was brought. All of the organisations in D10 Be Well were experiencing residents being distraught. Some of the organisations were working directly with the families and friends who were most affected by the suicides. We approached the staff team in NOSP, and they quickly recognised the need in the Ballyfermot community. They responded by commissioning 3S Solutions to look at what is happening with the women and to inform us of ways in which, as a whole community, family members, friends, organisations, both community and statutory, to come together in order for us to support and treasure women who are at a particularly difficult time in their lives and at their most vulnerable. We are now going to listen to a very powerful short audio clip from some of the women on their experience of clusters, some of the women and residents of the area, on their experience of the cluster of deaths by suicide, on their families and their communities. We'll just hear it now. Thank you.
Thanks for coming in today. I'm just going to ask you a couple of questions, if that's all right.
Yeah, that's fine.
So, about the recent suicides, I'm just wondering how you've been affected personally.
Well, personally, I just think it's scary to think that young people in the community think that that's their only option and that they have nobody to talk to. And it's personally, I think it's the people who look happy and actually, people you wouldn't actually think would do that, do you know what I mean? Happy, outgoing, like you think they have everything going from they're young, and it's scary and it's sad, to think that they have no other option and that's what they do.
And how do you think it's affected the community as a whole up here?
I think it brings the community down, because it's sad to think that every corner, or nearly every second corner in the park, there's memorials for young girls who have actually died. Do you know what I mean? And you walk by it and kids are asking then, and my kids would have known one of the girls who got committed suicide, and they're they're in disbelief as well, like they can't believe it because people, it's just unbelievable that community does suffer, yeah, it really does, you know.
Of course. And what would you say to any women that are out there now in the community that are struggling at the minute?
That they need to talk, they need to find somewhere or someone that they can trust, and that there is help out there, but you just have to look for it, you know. Find one of the institutes or one of the places around Ballyfermot. There is a few, but it's not enough, you know, because people just don't talk, you know. So I think they need to. I think they just need to talk, because I was struggling, you know, as well. And if you find someone who you can trust, and just to get you out of your own head, do you know what I mean?
Makes all the difference, doesn't it?
Yeah, sure does, yeah. If you have someone that you can trust and you can talk to, and you know that their phone is on, do you know what I mean? No matter what. That's it, really.
Well, thank you very much.
No problem.
Cheers.
Thank you.
Thanks for coming in this morning. I'm just going to speak to you about the recent suicides in the area and just ask you a couple of questions, if that's alright.
Yeah, no problem.
So how have the recent suicides affected you personally?
Through my family and my friends and people around me and the community.
Yeah. And how do you think it's affected the community as a whole?
It's a heartbreak. If I could help out, like, with people around me.
Yeah. And what would you say to any women that are out there that are struggling at the minute?
Do you know that there are services you can link in with? I'm here if you need to talk, my phone is always on.
Okay. Thanks a million for coming in this morning. Just going to ask you a couple of questions. How have the recent suicides in the area affected you personally?
Well, really circles we know a lot, you know, through kids, if you either friends or friends of theirs or something, you know. So, yeah, it really kind of shakes you up, you know, it makes you, you know, raw, and, you know, you feel like a lot of, you know, lost, empty, you know, sad, because you want to do things, you're not happy, you don't know what to be doing, and stuff like that, you know, like it just, yeah.
And how do you think it affected the community as a whole?
The community, with my boys, they kind of, you know, depression sets in with them, you know, and like that, you can go off the rails, you know, drinking and so, you know, just letting their own anger out and stuff like that, you know. But yeah, I think they feel a lot lost, sad, pain, you know, like, and you know, there's no hope or, you know, stuff like that, but yeah, you know.
And what would you say to any of the women in the community that are struggling at the minute?
Struggling, it's hard, but you got to just keep putting, you know, well, as I do every morning, if I wake up, it's a new day, so like that, like linking with the services, and you know, you have friends, phone friend, or you can ring, there's all different lines you can ring as well, you know, and just try, basically just try keeping focused, and like every day is not a dark day, even though it feels like it, but you know, it does. It's right at the end of the tunnel, as you say. Yeah.
And all we can do is our best, isn't that true?
Yeah, yeah. Be there for each other, you know, and just let them know that there's help there, or even if it's just yourself to talk to, you know.
Kindness goes a long way, doesn't it?
Yeah.
Thanks very much.
No problem, no problem.
Some of the women who participated in this webinar did not wish to be filmed. However, their key worker agreed to answer the following questions. How have the recent suicides affected you personally?
It's scary. My family suffered with suicides. I have lost family and friends due to suicides. I suffer with depression and sometimes I doubt myself. So I try to just brush it off, but it's so scary as the brain can only take so much before you snap.
How do you think it's affected the community as a whole?
It has affected my community big time. People as young as in their teens doing this, turning to drugs and thinking there's no way out. It's very sad to say, as you think it's the only way out.
And what would you say to any women out there that are struggling in the community?
Speak out, get help, go to support groups as much as you can, and just try to stay positive.
How have the recent suicides affected you personally?
Look, this participant said that he lost best friends a year ago due to suicide. It played a big factor in his own mental health. Second guessing if he was a good friend and supportive. Placed a black cloud over the community. Broken relationships amongst friends and disengaged in daily life, like routine changed, relationships broke, and everything changes.
How do you think it has affected the community as a whole?
This participant said that was devastating and heartbreaking. It was eye-opening that it can affect all walks of life. Second questioning, how could I have helped more? People turning to drugs to suppress feelings inside.
What would you say to any women out there who are struggling in the community?
This participant said that to link in with somebody or some services within the community, have a chat or give helpful feedback to somebody, and encouragement, letting people know that they're not alone.
That is indeed a very powerful piece from the women living in the community. I would like to thank them for their participation and giving us their insights. The women have really shown us in many ways, what we need to do here. Thank you. Now I would like to introduce Eamon Sedak from S3 Solutions, who completed this really important study through the first COVID lockdown. No easy achievement. Thank you, Eamon.
Thanks, Aniva. Good morning, everyone. If you just bear with me 2 minutes to get a set of slides up. Hopefully you can see that. They've come up on your screen. Look at very powerful and impactful video and some sort of raw contributions from people, and I think it really sets the scene for this presentation. For those that don't know me, I'm Eamon Sedak, founder and director at S3 Solutions, and I'm really pleased to be here with you this morning to share some of the findings from the rapid assessment. I think Suniva's already kind of set out the context for the rapid assessment, but I feel it's really important for me just to reinforce right at the outset that we understand that the lives lost to suicide have been really traumatic for the area. And this process wasn't about studying the individual lives lost. It wasn't about developing individual case studies. It was more about looking at an area level view of the key issues and challenges that may impact suicidal behaviour and identify potential risk factors to prevent future suicide clusters. So for those that are, I suppose, unfamiliar with the rapid assessment process, I think that the purpose of our work can really be categorized in 3 key steps. Number 1 was around mapping stakeholders and services in the area. Conduct a stakeholder mapping exercise to identify what exists, look at existing data, look at existing information about the area. Number 2 was consult as widely as possible to gain insights and understanding about the factors that may be affecting suicidal behaviour in the community. I think Suniva mentioned that we were commissioned in February 2020 in this piece of work, and we managed to get 1 day of interviews before the COVID lockdown took place. And I can't state enough how delighted I was that people engaged via Zoom on what are difficult conversations they have, but the level of involvement, the willingness of local organisations and individuals to take part was really overwhelming and has allowed us to finish the piece of work. And number 3 was, in light of the findings, I suppose, to present a report and identify some recommendations to support those and minimise contagion and suicide ideation. I suppose the plan here this morning is to give you hopefully a short but comprehensive overview of the key findings. So the first step in the process for us was to establish a rapid assessment response team. And that was made up of representatives from Ballyfermot Local Drug and Alcohol Task Force, Ballyfermot Chapel Izzard Partnership, Ballyfermot Star, HSE Addiction Services, TUSLA, the local HSE Resource Officer for Suicide Prevention, and HSE National staff from the National Office of Suicide Prevention. And their role was really to help guide the process, create opportunities to engage with local individuals and local people, and map services. And from there, the process was really around having conversations. I think overall we carried out 27 interviews with 30 individuals from across the area. 22 of those interviews were with service providers and stakeholders. So that ranges from those that are currently engaged in providing services like family support, like counselling, through to clergy, local politicians, and some statutory agencies. We managed to have 5 conversations with individuals bereaved by suicide, and we really, really value their input and willingness to come forward and talk about their experience and what were really emotive conversations. And then we had the opportunity to present sort of emerging findings to HSE staff, both at CHO7 and at National, from Addiction Services and National Office of Suicide Prevention. And that was really to present findings and negotiate recommendations on how this could be taken forward. And we also reviewed lots of existing data and research relating to the area, and I've compiled that into the report. And one of the starting points for us in this was to look at the area itself and explore some of the key challenges according to sort of statistical information and background research. And we know that the link between suicide and areas of high socioeconomic deprivation is well established. And in the report, you'll see references to research in Ireland that found that deprivation had the strongest independent effect on small area rates of suicide, with the most deprived areas showing the greatest risk of suicide. And I think it's clear overall that Ballyfermot and Cherry Orchard record high levels of disadvantage. And it's for us, rather than make up profiles for all of the 73 small areas that make up that catchment, we developed a case study on one small area to explore how deprivation really manifests itself. And when we talk about small areas, typically we're talking about a geography of about 350 people, roughly, covering about 116 households, and comprising about 3 streets. So the slide that you see in front of you shows how one small area compares to national averages across a number of key indicators. So you'll see there in relation to lone parent households, the national average is that around a quarter of households are lone parent, whereas in this specific small area, 68% of households were lone parent. Less than 4% of people in this small area had a 3rd level education, compared to nearly a third nationally. Almost a third of the small area have achieved primary education only, compared to 13% nationally. And in relation to female unemployment, you can see 35% of that small area were unemployed, compared to a national average of just under 8%. So based on those statistics, I suppose in this small area alone, there's likely to be around 68 to 70 households that are female lone parents out of 116. There are 6 other small areas across the catchment for this research that would be classified as very disadvantaged and have similar statistics to those presented here. And a further 56 small areas are considered disadvantaged, so would have slightly lower statistics than presented here, but are still much higher than national averages. And I suppose what this slide also does is shows a comparison of rates of hospital presenting self-harm. And data was provided to us by the National Suicide Research Foundation as part of the study. And it compares the rates of hospital presenting self-harm for females in the catchment area for this research with the national average during the period March 15 to August 19. And we know that self-harm is considered one of the biggest risk factors for completed suicide. And you can see a significantly higher rate in Ballyfermot and Cherry Orchard than in the national average. So I suppose what it allows us to say, the baseline position for people living in this area is therefore a higher risk factor for suicide than most other areas in Ireland. So what we concluded, I suppose, as part of the research is that there was a suicide cluster in the area in 2019, and that's going to be no surprise to the people that are listening here today. As Sunniva talked about how impactful that was in the local community. The suicide cluster, what we found, no one throughout the interviews could really speak with conclusive knowledge about the cluster, but the prevailing view was that most of the young women were from Ballyfermot, but others were from Clondalkin, Tala and Palmerstown. However, maybe family ties or childhood connections to Ballyfermot meant that most of the funerals took place there. It was perceived throughout therefore that Ballyfermot was disproportionately affected in terms of the presence and visibility of the suicide cluster and the potential contagion, and it had a huge impact and a palpable impact on the people that live there. As we mentioned before, the purpose of this rapid assessment is exploring area level factors that may have influenced that suicide cluster, therefore informing an area level response. So once we completed the interviews and we collated all of the information together, we categorized the findings under 3 key thematic headings set out there in the slide. And what the plan here is now to take you through each of those headings and discuss the various issues, challenges, and factors that came up throughout each. So what we found was that there was a clear synergy between what we heard in the interviews and the Circles of Vulnerability framework. And for those that are unfamiliar with this, it's a framework that offers something within which you can try and understand suicide clusters and contagion. So the Circles of Vulnerability model is based on the idea that every suicide is akin to a stone being thrown into a pool of water. So ripples spread out towards the edge of the water. And the extent of vulnerability to suicide can consist of geographical, social, and psychological proximity to the deceased. And the framework sets out that where there are multiple factors present, it can intensify the vulnerability for individuals. So when you look at the image on the screen, the geographic proximity talks about the direct exposure to the death. So those that are in contact or connection with a person shortly before they died are seen to be at more risk of contemplating suicide. When we think about social proximity, this really relates to the relationship that somebody had with the deceased, including in social circles, and it impacts on how close someone feels to the deceased, even if this is a perceived closeness. So in relation to the suicide cluster, throughout the interviews, the sort of prevailing view was that it was thought that they would have known each other, maybe because of social media connections or indirectly through social circles. In terms of psychological proximity, this talks about the extent to which people can relate to the deceased, potentially because of a cultural connection or a shared experience, whether that's through childhood or present, and therefore they perceive themselves as similar to the deceased. I think there was a strong feeling throughout the interviews that we carried out that young women in particular may be more susceptible or vulnerable to this notion of psychological proximity, especially where there's maybe an underlying issue such as domestic violence or loss of a child or sexual abuse or something that you can relate to. And there was a feeling from the contributors that contagion may be stronger in young women. And when a young mother in particular dies by suicide, the psychological proximity felt by others removes what would normally be associated as a protective barrier of parenthood for other young mothers, and it potentially legitimizes suicide for that catchment. And another dimension of the circles of vulnerability is around time, and obviously the 8 suicides that took place over a 10-week period within the cluster, and one of those occurred on the day of a funeral. So as I say, as we conducted the interviews, and we found that the circles of vulnerability model was a good way to try and understand and explain the cluster. So two of the other factors that perceived as influence in the cluster and contagion in the area came up. One around funerals, monumentalizing suicide, and I suppose I really want to stress at this stage that in all the interviews we carried out, contributors went above and beyond to acknowledge the right of any family to grieve and mourn for their loved one in a way that they felt is appropriate for them, and are absolutely aware that this is a really sensitive issue, but it was consistently referenced that there's a potential negative impact of suicide-related funerals, and that they have the potential to become glorified events that results in intensive partying, maybe that goes on for days, and potentially leading to risky behaviour because of the emotionally charged sort of social outlet that funerals sometimes can create. Maybe a rekindling with old friends, which can lead to excessive drug taking and risky behaviour. And to be fair, while this can apply to any person or demographic, it was perceived by those we spoke to as being more prominent in young people, particularly maybe for those that live outside the area. They've maybe lost touch with childhood or adolescent friends, and whose opportunities to socialise may be diminished or restricted due to other commitments. So therefore, that when the opportunity presents, that partying or socialising may become more intensified. And it's important to think going forward, managing the interface between the family and funeral times is going to be a key consideration. The role of the local physical and digital environment came up. Surprisingly, the role of mainstream media received very little attention during the interviews compared to the perceived role of social media. And I think there was a strong feeling that the extent to which people are now connected in social media is a key contributor and sort of broadening that social and geographic proximity, and therefore the exposure and potential impact of suicide. Others referenced physical monuments that are put up in estates in terms of the potential to monumentalize and glorify suicide. Although again, contributors sort of stressed the right of any family to mourn and remember their loved ones in a way that they see as appropriate. So one of the other things that we explored was the possible then area level factors influencing suicide and suicidal behaviour generally. So the previous slide looked at potential factors influencing the suicide cluster. This is area factors that look at suicide and suicidal behaviour more generally. And I think consistently and time and again through the interviews, the notion of the presence of underlying trauma came up in relation to young women in particular. Contributors talked about adverse childhood experiences, and we know from the research that adverse childhood experiences are more likely to be present in areas of deprivation, and those with adverse childhood experiences are more likely to have attempted suicide in their lifetime than those who do not. And for women who experience 2 or more adverse childhood experiences, there's significantly increased risk of attempting suicide at least once compared to those with no ACEs. And across the interviews that we carried out, all 10 counts of ACEs were referenced at least once. The domestic violence in the family home, abuse, whether physical, sexual, or emotional, the presence of drug and alcohol misuse in the family, presence of mental ill health in the family, and separation of parents came through as probably the most common forms of adverse childhood experiences for those growing up or living in Ballyfermot and Cherry Orchard. And participants also talked about other potential traumas, such as the loss of a child or bereavement, as contributing to the presence of an underlying trauma and leading to challenging mental health for young women. Another consistent theme was around the prevalence of drug and alcohol misuse. And again, cocaine was referenced consistently as the main problem drug. There was also references to Lyrica, the coming down phase being a particular concern. And alcohol remains an issue and a concern, although people reference that it's as cheap to buy drugs as it is alcohol now. And I think within the discussions around drug and alcohol misuse, there were 2 emerging viewpoints on that. Where there was a drug and alcohol misuse, contributors felt that this was likely to be a coping mechanism for a pre-existing trauma or an ongoing trauma or a current challenging circumstance, and not necessarily the root cause in itself. For others, the widespread misuse of drug and alcohol now, particularly amongst young women, could lead to more enduring mental health problems and potentially suicide ideation and suicide attempt. I think there's a strong feeling that kind of the sporadic and binge nature of drug use means that young women and others, young men and young people in general, do not identify with drug services because they may not see their drug use as their recreational drug use as a problem or problematic. And one participant talked about the escapism that permeates everyday life and highlighted that cocaine and alcohol are a means of escapism for people. Again, on social media, and we've referenced this previously, but social media tended to permeate all the interviews that we carried out. And there was a feeling that social media had the potential to amplify potential contagion through that geographic, social, and psychological proximity. But there was also a lot of discussion around the enduring potential negative impact that it can have on mental health for young women. And that was linked to this pressure to look good and be popular. You know, seeing friends posting about a social life, which can maybe deepen or entrench feelings of isolation, came up consistently. And maybe that being distanced from friends or peers can intensify that feeling of missing out. So then when an opportunity does present to socialise, whether it's a family gathering or a funeral, it may lead to excessive partying or excessive socialising that goes on for a prolonged period of time and may result in risky behaviour and drug taking. So one of the common themes again was around the accessibility of young women and aspirations. And what we mean by that is that participants talked about how young mothers or expectant mothers quickly become inaccessible during pregnancy and in the early years of parenthood. There was a palpable sense of fear around engaging with services, particularly those that are facing a trauma or experienced a previous trauma or have a challenging mental health condition because of the potential for social services to intervene, or even for the potential of how they might be perceived within their community as an unfit mother. Adding to that, I suppose there's a perceived lack of vocational opportunities, which in the main people felt were geared towards young men. And this led to a kind of perception or feeling that for young women who are in their late teens or early 20s, who may have left school early, who may have multiple children, and develop feelings of being stuck or that this is their lot at that stage. And that lack of aspiration can lead to entrenched drug and alcohol misuse and potentially suicide ideation. On the issue of housing, conscious that this is a national concern, But I think consistently in the interviews, and particularly with those that are involved in local political parties, they would say that those presenting in housing stress are typically young women with children. And there were numerous examples of families who've been waiting years. A mother of three have been waiting years for a house, and multiple references to young women maybe being put up in hotels as far away as Kildare, often 25 kilometres they travel in the morning to get their kids to school, adding significant pressure. And what was interesting was that what emerged was that the pursuit of a house often becomes the main objective, and that when that is achieved, often then support stops. But where there's an underlying trauma present for a young woman, then actually that enduring trauma exists and remains, and there's a requirement for additional support. And like others, domestic violence was raised consistently as a major concern, often perceived as being fueled by drug and alcohol misuse. But I think almost every interview referenced domestic violence as one of the most prevalent issues. And we have references to friends being aware of domestic violence, but feeling powerless to help. And I think during COVID, that has become amplified, and there's been numerous reports around incidents of domestic violence potentially increasing. So it remains an enduring challenge. So the third thematic heading was around service gaps and connecting for life. And I suppose they set out at the start that generally there's a view that there are a lot of services in the area, although many reported being under-resourced. Many had reported having waiting lists. I think there was one service referenced a waiting list of around 67 children for intensive child and family support. And added to that, an interesting theme around hyper-localism came up, where there's a perception that people will be reluctant to travel beyond their immediate area to access a service. So service providers themselves recounted stories of accompanying people to emergency departments. And one of the consistent things that came through was the negative experience that people have within EDs. Long waiting lists to access clinical psychology support, a perceived lack of consideration for mental health, a triage, and the perceived lack of connectivity between mental health and addiction services. And one of I think the quotes that stood out for me and my colleague Finbar across the interviews was that someone talked about how some people's addictions are so embedded that they need to take drugs or alcohol to get out the door in order to present with a mental health issue, and that this was creating a real difficulty for people. Whilst there are many positives, and the availability of support from PA to House and others was referenced consistently as being a positive in the area, there's perceived insufficient aftercare and support to mitigate against further incidents. Tala and St James's, as being the main hospitals in the area that service the area, are not participating in the National Clinical Programme for the assessment and management of patients presenting following self-harm. And given the rates of self-harm that are above national average, people felt that this was a concern. The lack of under-18 rehabilitation and treatment pathway for young people was considered a key gap and came up numerous times in the interviews. And in the engagements with HSE national staff and CHO7 staff, there was reference to the lack of adult primary care psychologists in the area, and a definite feeling of statutory mental health staff on the ground not aligning with the extent and prevalence of need in the area. So whilst there are a lot of services, a number of key gaps came through. In respect of Connecting for Life, I suppose the national strategy for suicide prevention, there was a broad sense against contributors of either feeling let down that there hasn't been as much done in the area as could have been, or that there was a lack of awareness about the Connecting for Life strategy. I suppose services felt frustrated that they felt there was limited scope for them to respond quickly to emerging concerns or issues. And whilst there is a Connecting for Life local plan for CHO7, many felt that it wasn't local enough, and that actually there was a need for greater ground up or grassroots involvement in those plans. And for many, their involvement in this research and the consultation process was the first opportunity to try and shape a community response. And on that community response, I suppose, and they offer some sense of hope in what can be quite a difficult conversation and quite a difficult presentation. There's an absolutely committed set of organisations in this area, both statutory and community and voluntary. And indeed, I would go further to say a committed set of individuals within those organisations who are absolutely motivated to trying to do something about these issues. And we know that Ballyfermot and Cherry Orchard have a strong history of community activism, and a number of contributors told me about the stone soup stories that came up, and that there's positive examples of groups working together, and a definite palpable sense of determination to do something about this and harness the assets that are the organisations in the area, but also the residents and the people that live there. So that led us on really in terms of the report. And with any report that we do, I suppose the report is only as good as the action that follows it. And I'm delighted here today that the purpose of this is not about the report. The report sets the context, the launch space, as Sunniva described at the start, which is really the beginning of the implementation of the key recommendations. So in the report, we had set out 9 recommendations that cover short, medium and long term. And there's an onus on clearly HSE and other partners around some of this, but there's also an onus on the local community, local residents to kind of come together and implement some of the recommendations to try and create change in the area. So for us, look, finally, a key point is we would like to acknowledge and thank everybody that contributed to the report. As Sunniva said, this took place during COVID-19. People came forward and offered their contributions in what we know were really, really difficult conversations they have and really emotive and traumatic experiences. We'd like to particularly thank the guidance and counsel provided by the Rapid Assessment Response Team and the organisations that took part in that. We really value the advice and guidance that they provided throughout. And I hope that the report resonated with people, that it does justice to the issues that are going on in the area, and it creates the impetus for some change and positive change to happen in the area. So thanks again to everybody for listening, and I'll hand you back to Sunniva.
Eamon, that was very powerful presentation with an awful lot of information for everybody. I particularly liked the whole framework, the circles of vulnerability, and it really does look at the whole contagion piece, which we were all struck by, both families and everybody else, what is happening. The circles of vulnerability really explains the contagion piece and what is happening. And as again, Eamon outlined, there's a lot of work in those recommendations, and we are all extremely committed to implementing those recommendations. But I'll lead you on now to Emma Freeman's presentation. Emma is the local HSE Suicide Resource Officer. And please, Emma, you take over from here. Thank you.
Oh, where's my screen gone? Sorry, I'm just having a... Where is it? Sorry about this, folks. Can you see that? Hang on.
We're good, Emma. We can see it.
You're
yep.
good. Okay. Can you hear me?
Yes. All's good.
Grand. Okay. Hang on. Okay. Hi, everyone. As Sunniva said, my name's Emma Freeman. I'm the HSE Resource Officer for Suicide Prevention in Dublin City on the south side. So easiest way to explain is I cover Dublin 2, part of 6, 8, 10, 12. I'm also a member of the Suicide Prevention and Community Engagement Group for Ballyfermot, which has been formed following the research recommendations. I suppose the purpose of me talking today is to say that we're really committed to making sure that this is not a document that lies gathering dust somewhere, and it's something that is an action document for us, and we really need to communicate that out to the local community as well. But I'm just going to give you a brief tour of what we've achieved so far. Obviously, we're just in very early days, but we have been up and running. So the first recommendation of Eamon's was to set up a leadership group, which was going to be based on the research implementation team. So that's Ballyfermot Star, the Drugs Task Force, myself, TUSLA, the Addiction Services and the Partnership. We've also added onto it at this stage Family Matters ABC, a project in Ballyfermot Star, which looks at access to women in services, and also 2 clinical nurses from the mental health services. We will also be adding on the housing manager from Dublin City Council, hopefully. Just to say that the membership is fluid. It will change as and when we see identified needs of what we need to do, and if we need to add people on at certain stages. We have drawn up a terms of reference for the group, so everyone knows what their role is within the group. As I said, we've identified additional members, and at the moment we've just started to scope the research recommendations. So Eamon's second recommendation was around employing a community research coordinator, because obviously there's a huge amount of work that needs to be done to fulfill the recommendations in this report. And often when you have a load of agencies trying to do it, it can be quite difficult unless you have somebody coordinating that role. So Clara is very kindly from the Drugs Task Force is looking at the initial work being done on a job description. So we decided that we needed to draw up a job description of what we needed that person to do within the role before we could actually then approach potential funders to see this is what we need. Is there any possibility for funding? We also need to identify where that position is going to be housed and managed. In terms of the critical incident protocol, which was the third recommendation, the National Office for Suicide Prevention has been working with the resource officers, some of the resource officers, to develop a national community response plan. This will, and that's near completion, this will form a template for local communities to develop their own plan. So when we get that plan, when that plan's finalised, Space will be leading on adopting the plan for Ballyfermot. So we will have a specific community response plan to suicide in the Ballyfermot area. Okay, in terms of suicide training, we do actually have quite a lot of training available at the moment. Obviously, it's not available at this moment because of COVID. But in terms of the National Office of Suicide has a suite of training programs which are available through myself. These include suicide prevention training, which is safe talk, a half days training, assist training for 2 days. We also have something called START, which is available at the moment, which is online suicide prevention training. We also have training on deliberate self-harm. And then we've also got 2 new training programs around bereavement, one which is for professionals and one which we go into local communities in the aftermath of a suicide. Storm suicide prevention training available in the community. This is currently being rolled out by Ballyfermot Drugs Task Force and the local area partnership. There's also the SEER training, which looks at harm reduction models in terms of substance misuse. We have also earmarked or been given through the National Office of Suicide Prevention of €15,000 for training for women at risk. This is going to be a specific program that we look at how to engage the women who are potentially at risk of suicide and how to build up their self-esteem and their ability to deal with some of the issues that they face on a day-to-day basis. We're currently drawing up a tender around this. In terms of the peer support network, Eamon identified in this that the best way to develop this would be when the training is available and we can identify people through that. We do have a model in Jobstown in Tala, which has been really successful, which is where the local community members themselves, community leaders, came together and did the Safe Talk training. They then did a video which made all the local residents aware in the community that they were available to talk to. So the premise was that everyone within Jobstown would be 5 minutes away from somebody to talk to. I think the powerful thing around this was it was both genders, male and female, and a variety of age groups who were people who were safe to talk to. So there would be somebody within that group that people in the community would feel comfortable talking to. We also, in the meantime, we're hoping through the community organisations and the work they already do in the community to possibly identify potential community leaders and target them to do the training when we can do it again. Okay, in terms of the under 18 services, we haven't really looked at this at all yet, but Eamon did say that we should be engaging with the local youth services around the UBU, your space, your place. Some of you might have been at the seminar on nitrous oxide that the Ballyfermot Drugs Task Force did, and there was a very powerful piece that was done around the local young people minding the skate park that the council had delivered for them, and how they cleaned it up twice a day and how it gave them a sense of pride. So it'd be around working in things of like encouraging people to have a sense of pride in their community, but also the people who are engaging to help us improve pathways to care for young women who are at risk or vulnerable to suicide. Okay, support and access program for young women. This would be a big piece of work. It would be looking at how to engage young women who are possibly hard to engage, and how we can support them in terms of pathways to programs. There is a piece of work being done in Ballyfermot Star at the moment with some of their client group, and it extends to Tala, of how to engage women in programs and help them get pathways to care. So whether we look at that and how we could expand it out to mental health, or whether we need a new program, this is sort of very much in the early stages, and we need to do a piece of initial scoping around that. And again, underneath that, the training for the women with the 15,000 grant would be included. Eamon said very rightly that we need to look at future research. So this shouldn't be a piece that is seen to stand alone. And it's really, really important for us to keep the voice of the young women heard. And obviously, maybe going forward, it's not just about young women, it's also other people who are at risk of suicide in the area. But through that, we need to identify what research is going on in the area so we don't duplicate it. So there's a piece of research going on in Ballyfermot at the moment, which gives a voice to women, which is the supporting women to access appropriate services. This is the piece of work I was talking about that Ballyfermot is housed in Ballyfermot Star across Ballyfermot and Tala. There is also a need to keep ourselves informed on other research that's available nationally and internationally around suicide risk, and in particular around the areas that have come up in the consultation of this research, which is obviously the higher risk of suicide when you're living in poverty or you're from a disadvantaged area, the impact that domestic violence and substance misuse have. And also, I think it's probably not a very well researched area because it's an emerging area, but the huge impact that social media has on the lives of young women these days. In terms of the national clinical self-care programs in Tala and St James's Hospital, we continue to work with the HSE Mental Health around the participation of St James's Hospital and Tala Hospital in the national clinical program for the assessment, it's a mouthful here, assessment and management of patients presenting to emergency departments following self-harm. Obviously, there's quite a lot of work going on behind the scenes around this, and we would hope to have some news around that down the line. Okay, thank you. Are we done, is it?
Thank you very much for that presentation and lots of insights there from Emma. Great to hear that there's going to be a specific response to suicide for Ballyfermot specifically. That's very, very important, obviously, and extra resources in that coordination post. How that pans out has to be decided, but that's obviously really going to support the community. And also just to say that the NOSP report will be shared with all the attendees and all of the slides after the launch. Now, without further ado, it's going on to next person is Esther Wolf. Esther is representing the HSE Addiction Services and how they can support the research recommendations. Over to you, Esther.
Thanks, Suneva. Can you hear me? Okay. Good morning,
yes,
everyone. Thanks, Suneva. Good morning, everyone. My name is Esther Wolf. I work as an education officer with the Addiction Service across CHO 6 and 7. I'm delighted that this important rapid assessment and community response to suicide and suspected suicide in Dublin South is being launched this morning. Similar to the previous speakers, I would like to thank on behalf of the Addiction Service HSE, S3 Solutions for their incredible work against a backdrop of COVID-19 and a very challenging year of 2020. In particular, I would like to acknowledge the impact and the trauma which has been experienced by the families directly involved by suicide. Our thoughts and sympathies are with these families and friends of these young women. It's important to say that Dr. Eamon Keenan, who's the National Clinical Lead for Addiction, really wanted to be present to speak this morning on behalf of the Addiction Service. However, he wasn't able to attend, but we felt as a group that it was really important that we get some views from him. And so he has communicated with me, and I'm going to share his comments with you this morning. So Eamon talks about the fact that we in the Addiction Service HSE welcome this report and recognise only too well the devastating impact that suicide can have on a community and has had on this community in particular. It is important to understand the range of factors that affect suicide in a community in order to develop effective responses aimed at reducing the risk. The report offers a number of recommendations, and we look forward to working closely with the group implementing these recommendations. Under Collecting for Life, the National Strategy for Reducing Suicide and Self-Harm, it is recognised that there were a number of vulnerable groups requiring particular attention and input. One of these vulnerable groups are the cohort of people who use drugs. The HSE Addiction Services, in conjunction with the National Offices for Suicide Prevention, are in the process of and are committed to rolling out specific suicide prevention training for staff and services working in the area on a national basis. This report highlights the need for such an approach. And you've just heard from Emma, I suppose, who's given you an overview of the different types of training, including SARE training, which is around screening and brief intervention. As a member of the Suicide Prevention and Community Engagement Group, I wanted to address a number of issues that came up in this research. As Eamon said earlier, drug misuse was identified across all of the interviews as an issue for many young women in this research. This included the use of cocaine, which was the primary drug, Lyrica, and alcohol. And I suppose what really struck me was that the element of price, the fact that drugs were as cheap as alcohol, obviously feeds into the whole process of availability. But it was also against a background of drug debt and domestic violence. Eamon also talked about the fact that there were two emerging views on drug misuse included in the report. He referred to the fact that the drug use was likely to be a coping mechanism for a pre-existing trauma, an ongoing trauma, or a challenging circumstance, and not the root cause in itself of those who died by suicide. I think this last point about it not being the root cause in itself of those who died by suicide is an important one for us to consider. I suppose it also more broadly tells us that there's always a context to people's drug use, and it illustrates, I suppose, the complexity of drug use and the issue of trauma, and I suppose the fact that those of us who work with people with addiction issues are now coming very much from a trauma-informed care perspective. The second emerging view in the research was around the sporadic and the binge nature of drug use, which illustrated that the young women did not identify with drug services, although we do know that there was some engagement with local services in Ballyfermot, but that these women ultimately did not see their drug use as problematic. For women with drug and alcohol issues who are not accessing services, they are hidden, and so also are their children. Some of the women who died by suicide were young mothers. This highlights the importance of hidden harm e-learning training, which is available for all services who engage with families who are affected by drug and problematic alcohol misuse. While I'm referring to the hidden nature of drug use in this research, this finding is not unique to Ballyfermot, Cherry Orchard, and it could equally apply to other communities throughout the country. I suppose the fundamental question is, how do we engage with these individuals in the first instance? It's really difficult for people to take that first step, to pick up the phone, to identify that they need help, or to actually come through the door of a service. So that's the crucial piece, I suppose, that we're all very aware of in terms of trying to get people to access the service. As an addiction service, our core work is with opiate users, And I suppose we provide a variety of different services, including outreach, harm reduction, counselling for individuals, rehab integration, supports for their families. And we also provide family therapy, which is provided through the Adolescent Addiction Service. However, we do fund a number of community drug services in Ballyfermot who engage in work that we don't do ourselves. And I suppose it's important to say that these services provide local data, which is then communicated back to the HSE Addiction Service and also feeds into national data figures as well. I suppose I'm picking up on that because there was a point made in the research about the lack of quantifiable data, treatment data. The other thing I suppose that I wanted to pick up on was the inadequate provision of mental health and under 18s services. So I suppose maybe at this point it's just useful to identify that we do have a child and adolescent psychiatrist for the service. YODA is the Youth Drug and Alcohol Service, which is based in Tala and covers Dublin South West and Dublin South City. And I suppose specific to Ballyfermot, there's the Adolescent Addiction Service that has been there for many years. And the family therapist over the years compiles Adolescent Addiction Service reports. And I suppose drawing from his report from 2019, I'm going to just take maybe a couple of headlines from that. But he identifies that in 2018, he would have seen 43 young people and their families. Their mean age was 15, and that included people who were new referrals, re-referrals, and continuances. The majority of these people that he has worked with are male. He does work directly with young people and their families, and he's also engaged in consultations with other services in the Ballyfermot area. I think an important point to make is that the majority of referrals that he receives are from social work, from schools, from alternative education centres, from the child and adolescent mental health services, but a huge majority of the referrals that he would receive as a family therapist are from families themselves. So I think that's a very important point, I suppose, to take away from this. The catchment area that he would cover was Ballyfermot, Palmerstown, Lucan, Inchicore and Clondalkin. Finally, I suppose I would like to say that this research illustrates the complexity, not just of suicide, but the complexity of drug use and the need for a community-based interagency approach. The Addiction Service looks forward to working with community partners and agencies in the near future in implementing the recommendations in this report. Thank you very much.
Thank you very much for that, Esther. That was very powerful indeed. Again, to see that Dr. Eamon Keenan has absolutely made the connection between people who use drugs and suicide and all of the trauma, pieces, that the ACEs that people, or the trauma that people have gone through to get to the stage of potentially dying by suicide. I think that piece about the pre-existing traumas is really, really important, and it's something that we're really going to expand on in terms of the implementation group. And in fact, to also recognise that the organisations and are all working out of a trauma-informed practice, as you said, recognising how difficult it is for anybody, in particular a woman, who is so vulnerable with children, and that fear, be it real or perceived, of their children being taken away from them. And it's a huge block for some of the women accessing services. But thank you very much for that, Esther. We now come to Kevin Brady, who's going to present now. And Kevin is the Head of Mental Health Services in CHO7. Thank you, Kevin.
Good morning, all. Thank you very much, Suneva.
Kevin, just to start your video there, for people can see you. Yeah, we can hear you.
Morning, all.
Perfect.
Apologies.
We have you now.
Thanks very much, Suneva, and thanks very much to Esther there as the last contributor. My name is Kevin Brady. I am the Head of Mental Health Services for Community Healthcare Dublin South and Kildare and West Wicklow. That encompasses the TALA services, the James's services, the Child and Adolescent Mental Health Services for the full area, among others, and the Kildare service as well. Obviously, the Ballyfermot area falls directly under the TALA catchment area for adult services and under the umbrella of the Lindara services, which is currently based in Cherry Orchard Hospital campus, which is close by. First of all, I'd like to thank all the residents and our partner agencies and organisations in Ballyfermot for their bravery in sharing their experience around suicide, which has made this report possible. The research shows, I think, as Esther has alluded to there, the complex nature of the area and the levels of presentations within the area and how we support them. It shows women who died tragically were facing a number of adversities in their lives: homelessness, substance misuse, adverse childhood experience, and the negative impact of social media. It's hugely important, therefore, that the agencies working around these factors continue to work with ourselves, who are one part of it, to look at how we can best engage and support other women who may be at risk in terms of their daily lives and in terms of their dying at risk of suicide. Mental health, both on the clinical side and through our resource officers, will be working on the suicide prevention and community engagement group as following on from this report. And it's hugely important that we are. And we'll look at innovative ways to engage and work with women who are struggling and continue to struggle. I think one of the important points for me is, in some respects, this isn't going to be a quick piece of work, but how are we going to move from, I suppose, a service that reacts and to a service that prevents? And that's a longer term piece of work that I'm sure will be supported by our partner agencies in trying to turn that around for the Ballyfermot area. From the HSE mental health perspective, as I said, Ballyfermot falls under the Dublin South Centre of Mental Health Services. And again, we have three adult community mental health teams in Ballyfermot. We have a community mental health team, CAMS community mental health team, and an inpatient child and adolescent unit in Lindara, which is based in Cherry Orchard, which is 24 beds overall. In terms of mental health recovery and early intervention, we have the EVE services as well, which is a community-based service providing recovery-based programs for people with mental illness and intellectual disability. We also operate the counselling and primary care services, which offers a number of sessions to people who are medical card holders as well. We also fund through Pieta House, a suicide bereavement liaison officer who can offer practical and emotional support to families bereaved by suicide. This is a relatively new service and started in the past year, and has already provided great support to families struggling in the aftermath of a suicide. I think Emma alluded there to the self-harm program in James's, and it's obviously part of one of the recommendations in the report. We've been, as I said, a huge amount of work is going on in the background to get the service started up in James's and TALA services. We certainly hope to advertise in the James's service for the self-harm nurses in the coming weeks, and are currently working with TALA Hospital as well to finalise the arrangements for the implementation of the self-harm programme in TALA over the coming months as well. We hope to progress those discussions. We have a number of mental health projects in the Ballyfermot area, including Pieta House, as I said, Candle Community Trust, Heads Up, and we work collaboratively with the other agencies in the area through the Ballyfermot Partnership and the D10 Be Well Network. We're committed to supporting the recommendations. I think a report like this can't be put on the shelf. It's so important that we support the Ballyfermot community and replicate this in other areas across our community healthcare area, but also other areas nationally, in terms of providing the best model of care to support communities when they are in trouble, and how do we provide that model of care that supports them as best we can. I'd like to thank all of the local agencies again for their ongoing work to support the community. My thanks to the National Office for Suicide Prevention, and Gemma Cox and Sarah in particular, and also John Meehan, who sent his apologies today. He's the Assistant National Director for the National Office for Suicide Prevention, but also for planning and commissioning in the mental health services. I look forward to further engagement with John in terms of supporting us and the National Office for Suicide Prevention, supporting us in Ballyfermot and this community healthcare area to support and roll out the recommendations herein. In recognising the local challenges as well, we have recently recruited a third resource officer for suicide prevention, and Jennifer Clancy has recently started and will work closely with Emma Freeman in the local area. And again, I'd like to welcome Gemma. She's only in the role the last 2 to 3 weeks, and again look forward to working with her, because again it is an area that we feel needs to be invested in, and we recognise that and have done so. And we're lucky to have the calibre of Emma and Eve and Jennifer working with us. My thanks to Eamon in S3 and his team for the report and all their contribution, and especially again the local women who formed the report. We'll continue and look forward to being an active participant in the group, and look forward to work with partner agencies in supporting the individuals in the local community. Again, mental health services can't do this on its own. Addiction services can't do it on its own. TUSA can't do the service on their own. The partnerships can't do it on their own. We have to work collaboratively together to support the community as best we can. Won't be done overnight, but we will continue to work hard with our agencies. As Eamon rightly pointed out, there are so many committed people in Ballyfermot and the surrounding areas. Let's build on that and keep the work going to support people as best we can and support the women in the community who are suffering and their families. Thanks very much, everybody.
Thank you very much for that very insightful presentation, Kevin. In particular, you know, you've said about the service who reacts to one that prevents. I think that says it all, really, isn't it? It's such a powerful statement. I think that goes for all organisations, and that is our journey, isn't it? To do that, to protect people. Great to see the resources coming in and the emphasis that you're putting in terms of the area as well. It's very much to see the third resource officer, and particularly in terms of James's Hospital and Tala, that there's work being done in the background, as Emma was saying earlier, in terms of making sure that they're up to speed in terms of self-harm. It's such a crucial element, and thank you for that, Kevin. I think we have some questions from the attendees now to look at, and we have the panelists who are looking at them as well. We have a question here, and if this might be directed at Eamon. The questions coming, if people are looking at the chat room in particular, from the National Women's Council, from Cleena Lochnan, and she says, thank you for your presentation, very important research. How can the lessons from this work and the new initiatives developing from it be shared with other areas around the country which have similar concentration of risk factors for suicide, particularly among young women? I might hand that over to you, Eamon.
Yeah, I mean, Sunniva, I know since the research has completed, and we've had a number of conversations about my own city in Derry, actually, that's had a difficult time during COVID. There were a number of women that have died by suicide. It's interesting that a recent report came out from Dr. Siobhan O'Neill, who's the mental health champion for Northern Ireland, where she talked about, paradoxically, there's been a decrease in rate overall during COVID-19, and puts that down to an increase in community spirit and the sense of in it together, and that there's support for people. But that's slowly dwindling away. And I think at some point in time, when you look at end of job retention schemes, that there potentially could be an increase or a spike. And I think that goes to Kevin's point around the preventative approach rather than reactive. Maybe there's an opportunity to be preventative now. I know in Derry, there's a really strong community infrastructure, like in Ballyfermot, around neighbourhood renewal, which is a fund that's specific to areas of deprivation here in the north. And there's organisations that get together in a similar way the space is going to try and do now. So I think setting up that infrastructure as a way to do it. In terms of how the learning can be shared with other areas around the country, I think forums like this are obviously useful in terms of sharing research. Obviously, and I see there's a comment on there around tapping into the potential positives of social media, not just the negatives. They engage with young women. I see a comment from Gemma Cox, who was on the steering group as well. maybe that's the same in terms of sharing the findings from this research and through organisations like the National Women's Council. Is there an opportunity to share the findings and maybe disseminate those across the country? Because I think there are opportunities for learning for other areas, specifically those that are have high socioeconomic disadvantage, and I mean things like lone parent households and low unemployment and low educational achievement are not unique to Ballyfermot and Cherry Orchard. There are a multitude of areas across Ireland that face similar circumstances, so we'll face similar risk factors. So I think that there is an onus to share these findings and obviously monitor how the outworkings of the recommendations, how successful they are, and also share the findings of that across other communities.
Thank you for that, Eamon. I know there's another question, particularly around Dublin City Council. I know they're not here on the panel, although I know they're in the attendance. I know the councillors and TDs also were participated in the study. And I know that Dublin City Council have been asked onto the implementation group and are coming on, so they will absolutely be part of the implementation of the recommendations. And I know we're very positively engaged in that. The other questions coming through are from to all panelists. I don't know who want to take up this. Women are often more likely to ask for help than men. Can we tap into this seeking behaviour using social media? I think that's a very good. I think Eamon mentioned that there earlier on, that social media can be negative. But perhaps it can be used as a very positive way as well to get messages across. And I think we're actively looking into that in terms of how we will use social media, particularly to engage in the community, into the community of Ballyfermot, in terms of getting people to know what has been said at this webinar, but also what's in the report. Does anybody else from the panel want to take up some of these questions?
So Niamh, I wouldn't mind commenting on
please.
that one again. I mean, it came up during the interviews that, and I think this is something that potentially, particularly in the community and voluntary sector and public, that using like targeted ads on social media is not typically a method that groups would do. It's normally associated with a private enterprise venture, but actually there could be something really effective. It came up during the interviews that paid social media ads that go out at certain times of the evening or certain times at night. I think there seem to be, if it's particularly at difficult times to engage people, whether it's evenings and weekends, times where people are most vulnerable or most at risk. There was a feeling that a positive message that comes up on a social media feed at a certain time may be the difference between somebody acting in a certain way or not. And maybe that's a method that people can try and harness the potential positive impact of social media by, as part of that access program, maybe paying for targeted ads on Instagram and Facebook so that those positive messages go out. They're targeted at young women or young men. I think you can do that on Facebook and others. You can have target segments, and it actually can be used as a powerful tool to get positive messages out there, or even if it's about reinforcing that there are people there that you can talk to and links to local organizations or the space implementation group that can then actually act and do something about it.
Yeah, Eamon, I think that's very powerful, and we'll definitely take that on board. Okay, there's another question in. How has the stigma of suicide been addressed when only last week the Irish Catholic published an article about suicide being a sin and an affront to God? I know I heard that myself. That's maybe for another day. It's quite shocking, that comment, quite shocking.
Yeah, and I would say, just to add to that, we do actually do a lot of work with priests in the aftermath of a suicide, and I wouldn't say that the priests that I've worked with share that view, and they're normally very sympathetic with the families, and I've found them very open to working with them, and certainly would not take that attitude with the families. So I don't know where that came from, Dermot, I really don't.
Thank you for that, Emma. And again, certainly the clergy in Ballyfermot are, as you said, extraordinarily supportive and central, in fact, and they were part of the study, central in terms of the report, and in fact will be also in part of the implementation team as well. Okay, I think that is more or less, we're coming to the end. We want to keep in time for everybody. So just to conclude, The focus of the report has been on women, and as shown here as being a major concern. There has also been many men who have died by suicide, and we've mentioned them, men as well, in the community, and they have left their families and friends and the community devastated. The recommendations outlined here today will inform the work that will be carried out to safeguard both vulnerable men and vulnerable women in the community. I would like to thank all of those that participated and contributed in the webinar today. This is the beginning, as we said from the start, and has been reiterated by all the panelists. It is the beginning of the implementation period, and here we are now. It has been a very important piece of our work is to ensure that the people living in the community and the families most affected have the opportunity to hear and contribute to this implementation. And we will see this as an absolute priority. So the implementation team space is planning how best to do this, and we'll take up your recommendation there, Elma. It's not an easy task, as you can imagine, during a national pandemic. But be assured that we are committed, driven, and we'll keep the pedal to the floor on this. Thank you very much, and this concludes our webinar. Thank you and goodbye.